I was on a board of the Indiana Primary Healthcare Association, Healthcare Association for a long time and continue to be a member of it. It's an association of community health centers around the state. And a number of years ago, they had a meeting in which they were all lamenting. These are CEOs of community health centers around the state, and they're all lamenting how expensive it is to buy health insurance for their employees. So they hired in somebody to come in and talk to them about how they can reduce their costs for health insurance for their employees. And in the middle of all this conversation, I finally kind of raised my hand. I said, so I'd like to understand, how many of you here offer free health care to your employees at your site? My hand was the only one that was up. I said, if you, as community health centers, believe that what you are doing in your communities is providing the best care that keeps your communities as healthy as possible and is good for your communities, why wouldn't you want to make absolutely sure that your employees are getting that care? A kind of schizophrenia about being the CEO of an organization versus being somehow involved in the community. Mm-hmm. That is to say that I think in some ways what we are trying to do in terms of fostering a healthy community, our primary work may not be in doing healthcare. In some ways, our primary work may be in what we do with our staff. Mm-hmm. And how we collect the staff and engage with the staff in ways that build a community of sufficiency and engagement and imagination where people really want to work together and work together well. Mm-hmm. And so we've worked at trying to make sure that everybody has a living wage. We have a really squished wage scale. Mm-hmm. It's really hard to raise a family on what a receptionist makes in Goshen, and so our receptionists make more. Mm-hmm. It's really easy to raise a family on half of what a doctor makes in Goshen. The doctors make half. Uh-huh. And then we have some single moms, for example, with 5 kids, who even with an above the normal wage scale kind of wage, can't make ends meet. So we have a living wage policy that those people get a 3rd check every month to bring them up. Mm-hmm. And then we have health care for everybody. And we have free health care at the healthcare center for everybody. And we pay 80% of deductibles, and we pay 80% of copays. And we have 8% retirement for everybody. And we have holidays for everybody. And we have paid time off for everybody. And we have 6 weeks paid parental leave, whether you're a father or a new mother, for everybody. And we currently have over 10 employees who are going back to college, and we're helping them do that and paying tuition